Good evening, everyone. Welcome to the open evening at Herts Essex Fertility. I hope you all can see me and hear me clearly. So let's get started. So what's in store for us this evening? So in the next half an hour, 40 minutes, I will give you a little introduction about our clinic. I'll take you through a presentation about what our clinic is all about. There is a Q&A icon at the top, and please, I've got my team members who are sitting alongside. They will be taking the question and answers, taking your questions. So feel free to keep posting your questions as we go along. At the end of the presentation, there'll be a little Survey Monkey link for your feedback, and we'd really appreciate if you could take a couple of minutes to give us a little feedback. It plays a very important role to improve these open evening presentations for future. When I finish the presentation, I will also take you on a virtual tour of the clinic. We will also send you a link in case you're not able to see it for some reason, so that you can have a little insight as to what the clinic looks like. So my name is Praveena Pai. I'm one of the consultant gynecologists and fertility specialists in this clinic. Joining me this evening are my lovely team members, Jackie McAdam, a senior fertility nurse, and the lovely Mana Max, who has put the whole thing together for us this evening. So a little bit about our clinic. Herts Essex Fertility was founded in 1989. We've got over 35 years of experience with more than 8,000 babies delivered thanks to HAFC. It is a state-of-the-art purpose-built clinic where all the procedures are performed under one roof. So, you're not left running from pillar to post, either to get your medications or to have your egg collection transfers and what have you. We provide a range of services, so it could be just fertility assessments. We provide gynecological screening. We undertake procedures such as intrauterine insemination, the IUI, more advanced procedures like the IVF, ICSI, PICSI, and I'll talk a little bit more about these in a bit. We also are one of the leading clinics undertaking surrogacy journey. We undertake egg donation and sperm donation programs. We carry out fertility preservation in the form of egg freezing and sperm freezing / embryo freezing. And last but not the least, we obviously carry out pregnancy scans. These pregnancy scans may either be because of pregnancies happening thanks to the treatment in the clinic, or even standalone pregnancy scans for somebody who's conceived naturally. I should mention that there are additional treatments like PGTA. You might have come across the terminology. It stands for pre-implantation genetic testing of the embryos for aneuploidy, or a few more specialized procedures. And that essentially means deselecting the chromosomally abnormal embryos, which otherwise are not going to give us pregnancy. So we do have those advanced treatment options as well. So what does fertility assessment mean? So we've got 3 types of fertility assessments that we offer. It could be a couple fertility assessment where you have the male and the female partner both being assessed. It takes place in 2 visits. It could be just the female coming and wanting to understand her fertility prospects. And again, this takes place over 2 visits. Or it could be just a male partner, a male individual who wants to understand a little bit about his semen parameters, and this basically involves the male dropping off a semen sample. We do, in addition to all the other parameters that you probably have possibly got done through the NHS or elsewhere, we have an additional test called the hyaluronate binding assay, HBA, which is looking at sperm maturity. And this male fertility assessment then includes, once the assessment, the semen analysis report is ready, it is then followed by a call with an embryologist to discuss the results. We take a lot of pride in our ultrasound scan and what we provide in those ultrasound scans. So we have got a 3D ultrasound scan facility whereby we can have a very refined look at the womb. So we do this via a saline infusion sonogram. So essentially it involves using a transvaginal probe, doing an internal scan, putting a little bit of saline into the womb cavity, which gives us a beautiful contrast. And as you can see here, it highlights any intrusions into the endometrial cavity like polyps or fibroids, which can come in the way of an embryo implanting and not something which are easily picked up on a 2D scan. We can also take a step further and look at the fallopian tubes and look at the, put a dye and then very gently look at the functionality of these fallopian tubes. And this bit is known as hycosis. Fit for fertility, there's a lot of emphasis on, the couples or the individual getting really fit and putting her or his best foot forward before commencing a pregnancy journey. And we've got a dedicated site on our website, www.fitforfertility.com, which gives you a lot of information on how to become the best version of yourselves before you undertake this journey. So what does the treatment pathway look like? So essentially it starts with, let's say the individual or the couple approaches the clinic and decides, yes, this is a clinic for me. I want to commence treatment. There will be fertility consents allocated. You will be sent login details in advance. You're expected to complete look at certain modules, complete some forms. If you've got any investigations or fertility investigations done elsewhere, we request you to upload them or send them across to us so that the consultant has got all the information to be able to give you a good bespoke plan. We also help you download an app called the Salve app, which couples and patients find extremely useful because this is a tool for you to communicate with us, even if it's late in the day, for example. It also helps you get the appointment reminders. It's a secure messaging portal. If you have questions about medication, treatments, what time to come to the clinic, and so on. So Salve app is downloaded. We then bring you in for an in-person appointment with one of our nurses for a pre-assessment. So essentially, this involves the nurse doing your height, weight, blood pressure, BMI. We also take blood samples for looking at the ovarian reserve, and this is known as AMH, anti-Mullerian hormone. We do the thyroid function test. Thyroid gland, which releases thyroxine, has got an impact on all our bodily functions. So thyroid, the TFTs become an essential part. And then, yes, if there's the male comes in, he also drops off a semen sample. So a lot of the sort of workup gets done in the pre-assessment appointment. And once this is done, you then have a consultation booked with one of the consultants. This is usually provided via Microsoft Teams, and I find that most of the patients love that aspect because you're not driving in, and getting agitated in traffic. But yes, if somebody wants to see a consultant face-to-face, that is not a problem. We are quite happy to have a face-to-face consultation as well. So invites get sent on the day or the evening prior if it's going to be a Teams consultation. And what the consultant does in this is he or she will take a very detailed look at the medical history, at the investigations, at the pre-assessment notes. And then we will help you reach a very sort of personalized plan to help you get pregnant, essentially. Screening bloods. So once we've decided on a plan and the treatment journey is about to begin, one of the HFEA requirements is that both partners, if it's a couple coming to the clinic, will require screening blood tests. So these are bloods which are done for HIV, so infection screen, essentially HIV, hepatitis B, Hep C, chlamydia, gonorrhea. And for the egg or the uterus provider, okay, we also have to look at the AMH. We want to look at rubella immunity. We look at her full blood count and her hemoglobin electrophoresis to ensure there isn't thalassemia or a sickle trait. These results must be within 3 months of starting treatment. Consequently, we try and schedule them as close to the start of treatment as possible, and they must be carried out either at HEFC, so in our clinic, okay, or if you've done them elsewhere, it's a necessity that they are done in a UK accredited laboratory. So I'll now take you through some of the treatment and what these treatments entail. So intrauterine insemination is a procedure wherein the healthiest available sperms are introduced directly into the womb. So IUI is a less invasive sort of procedure which helps a couple get pregnant, particularly in heterosexual couples who've got psychosexual problems. The female may be suffering from vaginismus. There may be erectile dysfunction or severe premature ejaculation in the male partner. Consequently, sexual intercourse is problematic. Okay, or it could be people using their own eggs and uterus with donor sperms. Okay, so in those situations, IUI is the first intervention that we offer. Let's now look at something known as in vitro fertilization, or IVF, which is, I suppose most of you would have either heard or seen somebody going through an IVF procedure. So let me take you through what an IVF journey looks like. So essentially, before an IVF treatment commences, as I said, we would have done the pre-assessment. A consultant would have looked and created a personalized plan for you. We would have done the screening bloods. Okay. So once all that is done, once the period arrives, we get you for a baseline scan anytime between day 1 to day 3 of your period. Okay, what is done at that appointment is that we, based on the plan which has been generated for you, we will commence hormonal injections on a daily basis, and these injections will go on for the next 10 to 12 days. What do these hormonal injections do? So essentially, they encourage the ovaries and the follicles within the ovaries to start growing. And by follicles, I mean small balloon-like structures which have got immature eggs, and we want to encourage these follicles to, continue growing those eggs, because that's what our interest is in. Okay, so this continues throughout the treatment until 2 days prior to the egg collection. Yes, there can be side effects, although I must say most of the women tolerate these injections really well, but we do warn them that, you might get headaches, mood swings, because these are hormonal injections finally. There could be breast tenderness, they could feel very bloated, particularly those women who've got polycystic ovarian syndrome tend to have a very enhanced version of these symptoms, something known as ovarian hyperstimulation syndrome. But we are very aware of this, and we will do everything possible to reduce the risk of ovarian hyperstimulation. Right, so once we've commenced the injections, what will happen? You'll have a couple more scans to monitor your cycle. So in the second scan, what we want to see is a picture like this, where we find this is a picture of an ovary, and you can see these dark circles. These are the follicles which have got eggs. We can't see eggs. Eggs get seen only in the laboratory under microscope, but the idea is these follicles will be harboring those eggs. Okay, so we want to see a good response like this. So we do an ultrasound scan around day 5 to day 6 of your injections. And what we want to see is, 1, are you responding adequately? 2, is this a good time to start another injection, which is called an antagonist? It's called cetrotide here on the slide. So it's an antagonist, and that is to prevent you from ovulating prematurely. So essentially what can happen is, when lots of follicles are growing, it can trigger the release of LH hormone from the brain, which will then get those follicles to ovulate, and that's not the idea, isn't it? We want those eggs to be collected. So that stops you from ovulating. We will continue monitoring the follicular growth, and each scan is important. A scan is done by one of the nurses or consultants, but after the scan, you get a chance to meet one of the nurses who will take you through all, the bits and bobs, like any issues with the injections. How do I inject? I'm getting some side effects. How do I, best cope with these side effects? And then what happens, what we want to see as we are monitoring your cycle, is that on the one hand, you should be developing a beautiful lining. So this is the endometrial lining within the womb, which is where the embryo will finally sit. So the pregnancy journey begins within this structure here. So the final scan will determine the date and time of the egg collection. So usually it's the 3rd scan, but potentially it could be a 4th scan. But yes, on the scan, we want to see, are we seeing a good cohort of really plump, mature looking follicles? Okay, and then we will bring about the final maturation of these eggs by giving you a trigger. The trigger in the vast majority is an HCG, a compound called HCG. But if we think somebody is likely to get into the OHSS situation, then we give them a GnRH analog, a slightly different kind of trigger. Very detailed verbal and written instructions are given to the individual or the couple as to how to get ready for the egg collection on the egg collection day. So what happens on the egg collection day? The couple is invited, or the lady is invited. Let's say she's coming for an egg freeze, for example. We take her into the recovery area. Baseline observations are done. Okay, if it's a couple, as I said, the male goes away to provide a fresh semen sample for us. The woman gets a chance to meet the anaesthetist, because the egg collection in our clinic is done under deep sedation, which is what a lot of patients like, because you certainly don't want to be awake when somebody's going around doing a transvaginal egg collection. So they love that aspect. You get to meet the anaesthetist. We then take you inside the operation theatre. One of the consultants will then perform the egg collection for about 15-20 minutes, half an hour max. You then get wheeled out into the recovery. Once you've come out of the anesthetic effect, you've gone and emptied your bladder, you've had a nice cup of tea, both of you are in the bay, let's say. The consultant will come back and then give you what is the initial egg number. So the procedure is completed, recovery is done, and then you're allowed to go home. So you essentially are in the clinic on the egg collection day for about 3 hours or so. Right, now let's take a little peep into what's happening inside our laboratories. Okay, so lab is where our embryologists are functioning alongside us. So what do we want to see in a lab? So just to be aware of the terminology, so day 0 is when the egg collection happens. All right, day 1 is where so 24 hours later is when they want to see a nicely, beautifully fertilized egg. Between day 1 and day 5, usually the embryos don't get disturbed. They go into what is known as undisturbed culture medium. Okay, day 5 is generally when the couples or the individual gets invited to have the fresh embryo transfer. And if we have any spare embryos left which are suitable for freezing, they get frozen on day 5. If some of these have not quite reached that stage, they're left another day. By day 6, we should have the final number of the embryos which are suitable for freezing, and they get frozen in our nitrogen tanks. So what happens on day 0? So on day 0, essentially, the embryologists undertake 2 procedures. One is egg freezing, and the other one is insemination. And I'll talk a little bit more about egg freezing initially. So egg freezing is a reproductive technique for fertility preservation. All right, the HFEA limitation, so somebody who wants to preserve their eggs, either because of social reasons or because of medical reasons, can do so up to 55 years. The quality of eggs, the quality is better at younger age, as is the quality of sperms. We know that there is a correlation between age and the competence of eggs. So that's why when we talk about egg freezing in our detailed consultation, we will take you through what's the age, what is the potential for these eggs, how many eggs might be a good number for you to give a reasonable expectation of 1 live birth, 2 live births, and so on. So yeah, that's the egg freezing, and there's plenty of counseling which is offered around it. The other procedure which takes place on day 0 is the insemination. So let's say we've got a heterosexual couple, eggs have been collected in the egg collection procedure. If the semen parameters are completely normal, then each egg is left surrounded by a few million sperms, and this bit is known as IVF. If, on the other hand, the semen parameters are not quite meeting the criteria, the strict criteria laid down with the laboratory, then the embryologist will give the sperms a hand, and this is known as ICSI, intracytoplasmic sperm injection. And what it essentially means is, and I'll show you a lovely video afterwards, is they will look for the best sperm under the microscope, and they will inject each mature egg with a sperm. Okay, so this can be a procedure which is resorted to in situations where there is low sperm parameters, or we find no sperms in the ejaculate, azoospermia, and we have to retrieve the sperms by doing a small operation and retrieving them from the testis directly. Okay, in those situations, ICSI is a must. If somebody has got MAR positivity, which means they've got lots of antibodies in their semen which cause clumping of these sperms, in those situations, IVF is not a suitable option. We recommend ICSI. And if I've got a couple who has had treatment elsewhere and they ended up with no fertilization after IVF, that certainly becomes an indication for ICSI. Okay, so here is a little video. As you can see, this is a video of ICSI, which even today fascinates me. So you can see there is a pipette. Okay, you can see that the embryologist is having a pedantic look under the microscope, looking for that one beautiful sperm. You can see lots of these little ones floating around. You can see the beautiful structure. It's got a head, a neck, a tail. We want to choose one which has got the best look. Oh, there we go. We've got one selected here. We're snipping off the tail a little bit, immobilizing that sperm, and then drawing it up in that pipette. Okay. And once that's done, we go to this beautiful egg, as you can see, which is being held with a holding pipette here. And this needle, which has got the sperm within it, is now injected into the cytoplasm of the egg. That's the intracytoplasmic sperm injection. So it's brought us close. And then, as you can see, it penetrates the zona, goes into the cytoplasm. We withdraw a little bit of the cytoplasm and then very gently inject that sperm into the egg and then gently withdraw that needle. Here we go. That's ICSI for you. So moving on, and last but not the least, we've got something known as PIXI. So if as I mentioned earlier, if the hyaluronide binding assay is showing a low value, which means low maturity index, then we will do another test called physiological ICSI to choose again the best and the most mature sperms. So what do we want to see? So be it IVF, ICSI or PIXI, what one wants to see on day one is a beautifully fertilized egg such as this. Okay, so you can see there is this egg and you can see two beautiful pronuclei. Okay, one coming from the sperm, one coming from the egg. If that is indeed the case, then the normally fertilized eggs are moved into an embryo culture. And as I said, this culture remains undisturbed. We don't have a look at it and we don't get, you don't get to have any more updates because embryo is left to do its thing and develop to the blastocyst stage. If, on the other hand, we find that there could be a woman who's got less reserve, she ends up producing fewer eggs, and we find that on the fertilization check, we've got maybe only one or two which have fertilized. We then don't want to leave them to the blastocyst stage. The worry being that we might not have any blastocysts for transfer. In those cases, we might bring the person in for a cleavage stage embryo transfer, which is either a day 2 or a day 3 transfer. On a day 2, we expect to see a 4-cell embryo. On day 3, we expect anything to have, the cells to have divided anything to between sort of 6 to 8 cell stage. All right. And then comes the day 5, which is the best way of, or rather the most robust embryos make it to this stage. And that's why, as much as possible, we try and take most women, most couples to the day 5 stage. So what does embryo transfer involve? So embryo transfer in our clinic, one of the other things which I must highlight is that we've got an embryo transfer service available 7 days a week. So we are running on Saturdays and Sundays as well. So because of this, we are maximizing the chances of pregnancy, not compromising the day where the embryo gets put back in. You'll be given an opportunity to look at the embryo on a screen before it gets transferred into the womb, and we do something known as an ultrasound guided transfer. We do offer an add-on called embryo glue, which essentially is a transfer medium in which the embryo sits or rests for a while before it gets picked up into the catheter and gets transferred in. And there are studies supporting the fact that use of embryo glue might improve implantation rates. I'd mentioned PGT in one of my earlier slides. So PGT is, so a little background about it. So PGT stands for pre-implantation genetic testing of embryos for aneuploidy. Aneuploidy means chromosomal abnormality. So essentially what we know is most of the cycles which don't work, i.e. they either end up with a negative pregnancy test, so no implantation, or they give us a positive pregnancy test, but somewhere along the line, maybe at 7-week scan or 9-week scan, we find that that embryo has stopped growing and it, we find that it's a miscarriage. So in the vast majority of these, we know in about 85 to 90% of these situations, the responsibility is resting with the embryo. This embryo probably was chromosomally abnormal, okay, and consequently either didn't implant or stopped growing. So PGT now is a technique which has been with us for a few years, okay, allows us to be able to biopsy. And as you can see here, we take a biopsy from the trophoectoderm. So I don't know if you can really see this. So you can see a single layer of cells which is going to form the placenta. We don't disturb the inner cell mass which is going to form the baby, but a few cells are sucked out from the trophoectoderm and sent to a specialized genetics laboratory. And by looking at those cells, the geneticists are able to tell us, is this chromosomally normal? abnormal? Is it a mosaic? And then it helps us decide, is this a good embryo to be transferring in? And so what would have been a live birth rate, let's say, of 35-40% in a cycle, now goes up to about 60-65%. That's PGTA. PGTM and PGTS are again, more sophisticated procedures whereby we can screen for single gene disorders like cystic fibrosis, Huntington's disease, or for structural rearrangements. And we do have that service. Embryo freeze. So 1 in 4 couples will have spare embryos to freeze. So anybody who's got embryos to freeze will automatically have the option of having those frozen, which is a good thing. It's like a little backup if the fresh one doesn't work. Or let's say somebody becomes pregnant with a fresh transfer, it's something to have in future to try for a sibling. So any embryos that have not been transferred are of suitable stage and quality can be frozen. This includes embryos that were biopsied as well. So yes, after PGTA, we have to essentially freeze all of them. And people are not planning to undertake any embryo transfer if they say, okay, or for example, if somebody's had OHSS and we don't think it's a suitable thing to do a fresh transfer, they will be electively frozen. So yes, we've got the embryo freezing facilities as well. And at the end of this, what we want to see you at a pregnancy scan where we can establish that it's a beautiful, well-established, correctly placed pregnancy where you can see a nice yolk sac, you can see a lovely fetal pole, you can see a nice thumping heartbeat. Okay, we do have 3D scans, so we can show you some lovely pictures as well. But yeah, essentially a pregnancy scan is something we always say we offer at 7 weeks, which is approximately 3 weeks from the date of the pregnancy test. And it's an important appointment because not only do we give you sort of reassurance about the pregnancy, but we also give you detailed information about what to do with the progesterone and other luteal phase support that you were given after the embryo transfer. All right, so that's the pregnancy scan. So that kind of finishes our IVF pathway, and I will now take you through the other services and other procedures that we carry out in our clinic. So let's talk about donation. We have a robust program to carry out egg donation and sperm donation. So egg donation is something which some women may resort to because of advanced age and they don't have good quality eggs left behind or don't have quantitatively, there's been a decline, they don't have enough eggs left behind. It may be because of early menopause, which is quite possible. It may be because of chemotherapy having destroyed the ovarian quality. Okay, there may be ladies or women who are born without ovaries. Okay, and therefore they have to use eggs from elsewhere. And it could be a case of surrogacy, whereby, for example, if it's a same-sex male couple, they want eggs, they want to use their sperms, they want to use the donated eggs, they want to fertilize, create embryos, and then these embryos can be transferred into a surrogate, helping them realize their pregnancy dream. All right, so that's about egg donation. And as I said, we've got a robust team looking after the egg donation program in our clinic. Sperm donation, similarly, there could be individuals who have no sperm production because of genetic problem. There could be a lack of sperms because of chemotherapeutic agents. There could be lack of sperm because of genetic disorders. There could be a single lady who wants to use donor sperm. So we do have donor sperm samples in our bag, which they can access. And of course, we've got same-sex ladies who would like to use donor sperms as well. So yes, we've got a very well-established sperm donation program running in the clinic. Surrogacy, as I mentioned, we are one of the leading clinics as far as surrogacy cycles are concerned. We've got more than 374 cycles to our credit since 2012, which is when our surrogacy journey began. We've got a dedicated team again looking after the surrogates and the intended parents. Many cycles also include egg donors, as I mentioned. If we have a same-sex male couple, for example, they can use donated eggs. They can use their own sperms, create embryos, and use it in a surrogate. Or we might have a heterosexual couple where, for some reason, the woman is not producing or is unable to use her eggs. Okay, single people using own gametes is also possible. As far as surrogacy is concerned, it could be a full surrogacy or a partial surrogacy. Full surrogacy or host surrogacy is what is undertaken in most clinics. And if you need any more details about this, we'll be more than happy to furnish you the details if you contact us. Right. Our clinic also undertakes a lot of NHS-funded fertility treatment. So we are in partnership with 3 ICBs, the Mid and South Essex, North Central London and North East London. Your ICB is determined not by where you live, but rather by where your GP is located. If you want more information, so I often find couples or individuals who have started the journey with NHS and they think, oh, I'm going to get a referral, but I've been to your clinic, I much like your clinic, and I want to see whether I could get NHS funded treatment in your clinic. By all means, look at the dedicated section on our website, and if something is not clear, please speak to us. We've got a dedicated NHS team as well to help you out on this front. So just a little bit more about what the ICBs include. So I'll let you have a read. Northeast London ICB includes the following regions. The Mid and South Essex ICBs include the following. And the North Central London ICB includes these regions. And for some reason, if you find that you don't qualify for NHS funding and you find that these prices, the fertility treatment are quite expensive, which I agree they are. There are some other ways. Okay, so we do have something known as the egg share scheme and the sperm share scheme, whereby an individual can either share out her eggs, share his sperms, and get their own treatment significantly subsidized. So if that is something which you think you might qualify for, it's something which you think sits well with you, something which you might want to do, please again speak to us and we can give you more details about these schemes. Right. So thank you for staying with me till the end. We've got this March special offer. So generally we say new consultations, the full price is £250. But if you were to book this with us by 31st of March, we'll give you a 50% discount on this. So the discount price is £125, which does not include the blood test and semen analysis. All right. So the date is by 31st March 2025. And before I leave you, a little bit more about the funding. So we have partnered with Access Fertility as well as Assured Fertility. So if you think you want to, probably talk with them and have a look at the packages, by all means, have a look. Okay, and if you need any assistance on that front, we've got our finance team who are more than happy to help you with any questions. Wellness at Herts is taken very seriously. Now we know it's a difficult journey. It has its ups and downs. It's emotionally challenging. Okay, there's a lot of support that you'll find on our website. But I think there's only one thing I want to say. You will find that this clinic, at every step, you'll find us with you. Okay, we don't say that every individual or every couple who walks out of the door is going to go away with a positive pregnancy scan or what have you, but you will find that you'll never be alone on this journey. We also have a dietitian, Alex, who works closely with us. So if you feel you want a more bespoke or a tailored treatment because of certain conditions, for example, PCOS, etc., please find her, and she's more than happy to give you a one-to-one advice about nutrition. So why us? When there are so many clinics out there, well, we've got our experience. We've got 35 years of experience looking after fertility issues. We offer 7-day-a-week lab service. We've got 7-day-a-week embryo transfers. We've got a very robust electronic witnessing systems to ensure there is no mixing of gametes, eggs, sperms, embryos, or what have you. We've got over 8,000 babies delivered. Thanks to HAFC, you will find support throughout your journey. And we've got free parking. Sorry. Yes, we do have free parking. But I think another thing I must mention, which is not on the slide, is the location. A lot of couples do tell me this, that they find it quite. So we are kind of located in Essex, but we are very close to A10. We are very close to M25. So, in terms of geographical location, I think couples find it's a very nicely placed clinic. But equally, it's not bang in the middle of central London, for example. We've got a beautiful park, we've got a canal, we've got lovely ducks. So if you want to have a little, get out in the nature, we are very well suited for that. Enough of me talking. Once again, thank you so much for staying with me. Okay, we value your feedback. So Mana would have sent you a little link for the Survey Monkey. Please do drop in your comments. It means a lot. It goes into improving these presentations. Follow us on social media. So there are various hubs where you can follow us. If you want to book an appointment, we will get in touch with you again tomorrow, but if you've got our number, you can drop us an email or inquiries at hertsesexfertility.com. New consultations should be available, I'm told, within the next 4 weeks or so. And before I say goodbye and a good evening to all of you, once I stop sharing, I will take you on the virtual tour of the clinic, so please don't go away. I hope you've been sending us questions, and I'm sure Jackie is already working through those, but I will go and join her once I'm done with the virtual tour. So once again, a very big thank you from Herts Essex Fertility family for joining the open evening, and I hope to see a lot of you in person in the clinic soon. Thank you. So I'm just going to take you on the virtual tour. Here we go.